morning, Eddie. Afternoon. Thank you for joining me for today's COVID-19 weekly update. I'm pleased to be joined by Dr. Romero of the Department of Health today, Secretary Johnny Key of Education. We also have remotely Larry Shackelford, CEO of Washington Regional Medical Center and member of our task force. And we also have Lance Taylor here of the Arkansas Activities Association and give us a little update from his perspective. I first want to remark that I have set up a series of community action meetings that are designed for getting real counsel from local leaders in terms of how the community is handling COVID, but also to spur local engagement. And my first meeting today was in Saline County, and I was so impressed by the local officials who were there and the discussion that we had. One of the takeaways from my standpoint is that the mayors of multiple cities who are saying that the mask compliance is very, very high in their communities, and that people are wearing masks in the stores. They are as well, and I was encouraged by that. We had a very good discussion on vaccine distribution plans, testing whether, looking at our plan and then how that works in Saline Memorial Hospital and with Westside Pharmacy that are partnering to make sure that those first batch of healthcare workers will be covered. And so we got into details on that. I got feedback on our proposed and discussed new guideline that would require any indoor event in commercial properties in a commercial setting to have prior approval of their plan by the Department of Health. And because of the feedback and making sure we have all the questions answered, we're not issuing that today. We want to continue to hear from the communities that I'll be visiting later this week, and we want to make sure that we get that right. But we do encourage anyone, particularly during this month of December and January, if you're considering an event, please feel free to call the Department of Health for guidance, to let them know what you're planning, what safety precautions you have in place, and even though that's only mandated for groups of 100 or more to get that prior approval, they stand ready to help in the event that there's a wedding or an event that there's an employer get-together that needs to have that kind of guidance, because we want everybody to be safe. We haven't finalized the guidance yet, but we want everybody to take the necessary precautions. I would emphasize that what we're talking about does not include places of worships or restaurants, because they have their own separate guidelines that are in place in terms of the restaurants. Houses of worship are in a separate independent category. With that, I am also pleased to say that we have signed off on FEMA has signed off on the utilization of the 10 hospital beds at the Veterans Administration Hospital, and so we do have access to that. We're pleased with that. In terms of TraumaCon, which will help us to allocate the hospital space that's available in Arkansas, that is on target. We're hiring the resources for it. We hope to meet that deadline that we set of 2 weeks from last week. And then we also am pleased to say that we have received 125,000 additional Binex test kits. That gives us the rapid testing capability, and that's been useful for our schools that have implemented this, for our Department of Corrections, and Secretary Graves says the ability to do a rapid test of the employees is really making it a safer environment in the prison setting. And so we're pleased to see this additional shipment, and we also can use that through our Department of Health local facilities. With that, let me go to our case report. And this summary tells it all, that first, if you look at our total cases, we have 2,283 additional cases in the last 24 hours. That includes both probable cases and confirmed cases, which means that our antigen testing is picked up again. That's what happens on a Tuesday. And if you look at our testing numbers, we've got back to a very high number. Over 13,000 tests have done, combination of PCR and antigen. Whenever you see the antigen test at 3,900, that's pretty much going to mean that we're going to have an increase in our cases because they have a higher positivity rate. Our hospitalizations that went down yesterday is back up today by 28. Our ventilators is no change, but sadly, in terms of our deaths, we have an additional 39 deaths over the last 24 hours of Arkansans that have died as a result of COVID-19. That's a startling reminder of the continued challenge that we face, the deadly nature of this virus, and how we have to protect not just ourselves but our loved ones. And as the virus might be spread, it could go to somebody who has a vulnerability in terms of preconditions or other health conditions or their age, and we would not want that to happen. So that in and of itself is a motivation for us to protect others with our own behavior. And if we look at this, well, finally, look at Pulaski County and Washington County in terms of the total new cases, 230 new cases in 24 hours in Pulaski County. Washington County, 175. And so clearly, we have a lot to be careful about. And then let's look at the trend lines, which we like to do once a week. The 7-day rolling average of confirmed and probable cases both, you can see that trend line is up. And that dip down was really over the Thanksgiving holidays in which our testing was down. And so you can see the trend line has been fairly consistently up. Next, you'll see it week by week that tells the same story. And so the week of the 39th week, that last week, November 29 through December 5th, you can see the increase in cases over that week-to-week period. In terms of hospitalizations, this is good hospital management. I applaud our hospital workers, and I think it also is reflective of some improved therapeutics that are being used, and so there is some level of steadiness there, but it could surge forward at any moment simply because of the new cases that we have been identifying. If you look at the 7-day rolling average on positivity, this is just of our PCR test, and that's above 10%, so it's too high, and we hope that that can come down. It takes everybody's help to get that done and a lot of testing. If you look at the next one is both the PCR and antigen test. Antigen test at a higher positivity level, and you can see that's a little bit higher than what we were simply on the PCR test. And this looks at the statewide perspective, and this is by public health region in Arkansas. And the top line is the Northwest, and you can see the trend line is up. You can see both the yellow, which is central, which is metro, and that is up, as well as the blue, which is northeast, and then the green and red is our southwest and southeast that are on the lower side, and their trend line is not as dramatic as the others. And then if we go through a little bit more detail, this is the growth rate by public health region over the last week, and you can see this is percentage-wise. It's a little bit misleading, but the Southeast is growing at 9.9%. Northwest is down at 8.7%. But if you look at the raw numbers, you're going to see more dramatic numbers. Next one, this is the number and growth rate of confirmed and probable cases. And here you can see in the middle of the Northwest region has increased 4,600 cases. Central Arkansas has increased 3,031, Northeast 2,898. And so even though percentage-wise it's not as dramatic, the raw numbers shows significant growth in those two areas of the state. And this shows by age group. I just like to show this to remind people that obviously we worry about those 65 and plus that contract 9.5% of the cases, but the 0 to 17, 9.7% growth rate during the last week. And whenever we see that, we recognize they might be asymptomatic. They might feel fine, but they might be contagious at the same time. And so we've got to watch each age group and be responsible because of the impact it can have on other populations. I believe that concludes that. And with that, I'll invite Dr. Romero for his comments.
Adding just a little bit of detail to what the governor has already said, we have had no increase in ventilator use over the last 24 hours, so we're still at 182. Our reserve for both ventilators and beds is still adequate at this time. Our testing continues to be robust. We are down a little bit on our commercial testing, and I expect that to go up over the next couple of days, so we may be seeing some more increase in our number of cases. Let me just add something, the top 5 counties with over 20 cases. The first one has been mentioned, which is Pulaski County, followed by Washington County, followed by Benton at 151, Garland at 118, and Faulkner at 115. As you can see, spread is still going on in these communities and needs to be mitigated by appropriate use of the mask and washing of hands and distancing. Again, I want to stress the importance of those simple measures. The CDC has come out with new recommendations with regard to the use of masks in inside settings, so that if you go into a store, if you are inside a building, you should be wearing a mask just like you are out in the public. So masking at all times is essentially what is necessary at this point. Non-essential travel is strongly discouraged. And if you are to do so, then you should look on the website regarding the CDC website regarding recommendations for testing pre and post, and for measures to be taken during the time of travel. Again, discouraging travel very, very strongly. So I'll stop here and turn this back over to Secretary Key.
Thank you, Dr. Romero. So in the last week, we had 16 districts or schools that have made modifications to on-site instruction. Being that that's the week after Thanksgiving, I thought that was a very positive development with that number. That brings us, as of yesterday, to 22 active modifications and 317 that have now expired, and those districts or schools have returned to their regular operation. As we near the end of the first half of our school year, I wanted to look at some additional data, and I asked our team to pull some numbers out regarding the total number of districts and schools around the state, and who that have made modifications or have not made modifications. 71%, or 187 of our districts around the state, have not had to enact district-wide modifications, versus 75 districts, or 29%, that have had some type of district-wide modification. I think this is a very positive result, and in the next set of numbers really demonstrates that as well. 828 schools have not had either a school-wide or a grade level modification, 79%, as opposed to 222 or 21% of our schools that have had some type of modification. What does this mean? This means that our administrators and our educators are continuing to do a good job of keeping kids in school, knowing that every school in the state, every district in the state has a virtual option. But even for those that have virtual options, they are stressing the importance of on-site instruction and keeping that done in a safe manner. Finally, I want to give a brief update on the number of districts that have signed up for the Binax Now testing. This is the surveillance testing that was mentioned earlier today. 72 districts have signed up for this, and they are in the process of either having implemented that or getting the training for that. And the feedback so far has been very positive. While we're still crunching data, we can say from superintendents that have provided us feedback, they have found this to be a very effective use or very effective method for screening their employees, their staff, and identifying cases early before those staff members get into a situation where they might expose others. Thank you.
Yes, very proud to be here today. I want to make sure I tell you my gratitude to the governor and Dr. Romero and Secretary Key. And not only from myself, I get so many letters from parents, from students, from coaches, but I think more importantly, from superintendents and principals talking about how our activities and our athletics have got school back into and help kids get back into some kind of normalcy. So again, we receive that every day, and I want to pass that along to y'all because we know that y'all are the cause of that, letting our kids compete. So thank you very much for that. We've had a great fall. We have finished everything that we have started so far, and we're very proud of that. We thank our schools, we thank our coaches, and we think they've all done a great job following the guidelines set forth by the Department of Health of what you see Secretary Key reported on, how many of them have not had to adjust at all. And our athletes have done a wonderful job. And we're almost to the end. We have football to finish up the next 2 Saturdays, and we have state cheer. But we have a lot of activities that have already finished. So again, between athletics and activities, we were very honored to have finished, and we look forward. And again, my message here last time is going to be the same thing. I know out there, if you're a parent or you're a fan or if you're a student or if you're an athlete, a coach, this is the most important thing that we can wear. And again, we've done a great job in the schools, and that's why we've got to finish cross country, golf, tennis, state cheer. Oh, state cheer's coming up, state dance, volleyball. So again, keep wearing these. I know it's not the most comfortable thing, but it will make our kids successful and make sure that they're able to finish their seasons. Thank you.
Thank you, Lance, and congratulations on a successful fall. Let's get through the winter in the same fashion. And now Larry Shackelford is with us, CEO of Washington Regional Medical Center, and he's also on our winter COVID-19 task force. It's been greatly beneficial. So Larry, why don't you go ahead and make your comments, give us a little update.
Okay, Governor, thank you for the opportunity. It's my honor and privilege to be here as a representative of the Governor's Winter Task Force. As a task force, we are meeting weekly, not only as an entire task force, but also in the 4 work groups. We're being very diligent in the charge to look at options and recommendations. What can we do to properly allocate resources to be sure that we're doing what we can to reduce the spread. I would like to pause and again say thank you to the frontline healthcare workers, not only here in Northwest Arkansas, but all across Arkansas. We recognize how tirelessly that you work. We understand that you're tired, and we truly thank you for the work that's done. In terms of here in Northwest Arkansas, we do have not only the capability, but the capacity to care for our COVID and our non-COVID patients. But we have continued to see for the last several days, Washington and Benton County cases being in the top 5. Just today, over 300 additional cases in Washington and Benton County. We are seeing over the last 2 or 3 weeks that is resulting in more patients needing inpatient care. We've grown over that period of time from the number in Northwest hospitals in the 70s to today over 110. This is a rate of growth that we really need to change moving forward. On the positive side, PPE is good. Testing is good in Northwest Arkansas. We've seen improvements in availability of testing supplies, providing adequate access, and really encouraged that turnaround times have greatly improved. Here at Washington Regional yesterday, we tested over 480, and I don't believe we have any results more than 48 hours currently outstanding. But this next 2 to 4 weeks is key. We know that resources, including hospitals and clinics, are going to be tested. We're up for that test, but on behalf of all of the healthcare workers in Arkansas, I would urge you to everyone do the right thing. We need to pull in the same direction to be sure that we're successful moving forward. I'm so pleased Dr. Romero consistently talks about wearing a mask, watching your distance, washing your hands. That message is not new, but it's more important today than ever. But as the governor mentioned earlier, we really need to watch gathering in groups. We know that it's winter, we spend more time inside, but if you're going to be gathering in a group, whether at work or socially, be very cautious. Arkansas Department of Health is here, that they're a resource. If you have a group of 20 or more and want to talk with them about how that group can safely meet, I would definitely encourage that you do so. It's time now that we double down our efforts. I'm encouraged that we've had good news in terms of vaccines, good news in terms of the antibody treatments that are really positively impacting and keeping patients in that different non-hospitalized environment, but it's even more critical moving forward. So with that, thank you, Governor.
Thank you, Larry. A very good report, and you'll be available if there's any questions I need to throw your direction with that. We'll turn it open for a few questions today.
Could you clarify? So you met in Saline County this morning, right? And did I understand you to say that you got feedback? The feedback you got on restrictions on indoor gathering that made you decide to address this later after talking to other communities?
There were some questions asked. We want to have clarity, and that's, if you do a regulation or a guideline that's out there and it's not clear or it causes confusion, you're doing more damage than good. And so we're trying to get this right, and there were some questions that were raised. What does it apply to within the school environment? I wanted to make sure that we have all those answers. We're still weighing this, and so we're going to continue to work on it.
Do you anticipate having more restrictions, however?
I've indicated that we want to discourage venues that have crowds that can spread the virus when there's not the social distancing, the public health guidelines that are in place. We want to discourage that. I think people are actually doing this on their own. In Saline County, a number of different events have been canceled. At the governor's mansion, events have been canceled. And so, some can be done very safely, but, people are making judgments. And so this is slowing down naturally, and partly because we're talking about it and the risk associated with it. We may or may not actually put it in a guideline form. We're going to wait and we're going to try to get that right and make that judgment.
In the College of Public Health forecast, they mentioned that contact tracing will be more difficult with all these new cases. Do you know how that's going? Do you have enough contact tracers?
On contact tracing, I mean, they're overwhelmed. I mean, you know, and the biggest challenge is the nurse investigator portion of it, which is before it's turned over to the contact tracer, and they have more flexibility. But the nurse investigator has been challenged, and that's why we brought in, 30 National Guards to assist in that. And so that's a resource challenge for us. In terms of timelines, Dr. Romero, did you want to comment any on the timelines?
Maybe Dr. Sima has that.
Dr. Sima, do you want to talk about our contact trace? Yep, it's good. Our resident expert here, give us a little update.
Yes, thank you, Governor. As the Governor mentioned, we do, and Dr. Romero mentioned, we do keep tabs on our contact tracing as well as case investigation from a QI, QA standpoint. How long is it taking for results to get investigated, how long to get sent to contact tracing, and so on and so forth. And as the Governor mentioned, we do see a little bit of an increase in the time that it takes for cases to be investigated that is proportional to the number of cases that we're seeing. And as a result, that then, the longer time it takes to investigate a case, that contributes to the time that it takes to do the contact tracing. So we are keeping tabs on that. We are working diligently with our contact tracers and make sure our processes are as efficient as possible, but this is a numbers game at the end of the day.
Thank you, and let me emphasize that contact tracing is still very, very important. And so we need to continue to respond to these calls, and sometimes you'll get it after the fact, and many times the individual who has tested positive has already quarantined, has already called a number of people and said, I tested positive, you need to be aware of this, and steps are taken. And so a lot of this flows naturally, but the contact tracing is still a very important part of our strategy for isolating the virus and making sure that we don't add to the spread. So it is useful, continue to respond to that. Are there any questions remotely?
Governor, this is David Ramsey with the Arkansas Nonprofit News Network. A couple of questions regarding the case investigations. You said last week regarding potential restrictions that basically the most important question is where the cases are coming from, and that health department data says that bars, restaurants, and gyms aren't a significant source of transmission. Can you comment on whether the case investigation data is good enough or the methodology is designed to answer that question? Because at least based on what's been publicly released, it's not clear sort of how many people are responding or whether the information that we do have is conclusive on that question of whether it's coming from bars and restaurants. And second question along these lines, you said that the vast majority of cases are coming from social gatherings. Is there specific health department data regarding the frequency of transmission among family or during gatherings that take place in homes?
All right, so Dr. Sima, do you have a comment on this? Come forward here. And so we will answer this. I'll let them answer it. If we need to follow up, we can do so. Dr. Sima.
Yes, thank you. Regarding the information on bars, restaurants, what we put out publicly, that is a question that we ask every single case. Where have you been? What have you been doing in the past 14 days? Now, unfortunately, because of the long incubation period and really, the various times that people can become infected at different places, it is exceedingly difficult to pin down where exactly somebody was infected. So we're trying to capture as much detailed information as we possibly can. A lot of this information is qualitative in nature. The social gathering information, as the governor mentioned, is qualitative in nature. We are analyzing that, and we are finding social clusters that related to Halloween. We'll be looking into social clusters related to Thanksgiving as well as that data becomes available.
Next question.
Hi, Governor. This is Allie Lynch with 5 News in Northwest Arkansas, the River Valley. My question to you is, what is the state's plan on distributing the vaccine? Who will be the first in line to receive the vaccine?
We'll be following the CDC guidelines, and the first batch of the vaccine, which hopefully will be approved this week, will go to our healthcare workers. And then as the Moderna batch is approved by the FDA, then that will move into our long-term care facilities for the residents of our nursing homes and their staff. It should be noted that as the first batch goes out for our healthcare workers, that there will not be sufficient in the first round to vaccinate everyone, and so we will be waiting for additional shipments to be able to conclude all of our healthcare workers, and then it will move on to other priorities. The first 2 priorities, again, are the healthcare workers and then the long-term care residents and staff. Those are 2 important ones, the most vulnerable and those that are really on the front line.
Governor Mike McNeil at MagnoliaReporter.com. I have a question for Dr. Romero. Here in Columbia County, it's easy to walk into the health unit and get tested for COVID. However, it's my understanding that in densely populated areas like Northwest Arkansas, waits are long and getting test results takes even longer. Is that true? Are you concerned about it? And if so, what is the health department doing to speed up the process?
I'm going to let, obviously, Dr. Romero answer that, but I would refer you back to what Larry Shackelford at Washington Regional Medical Center said earlier about their testing capacity in Northwest Arkansas.
So we do have the capacity to see patients and individuals for testing up in Northwest Arkansas. One thing that's important to keep in mind is that you need to make an appointment. It's not just show up because of the scheduling of individuals. So we know that there's a press to have this done. I've not heard that people are being turned away or that there is a prolonged waiting period, but I will look into it. Our turnaround time still continues to, we try to reach that 24 to 48 hours. I haven't heard from my epidemiologist that that is being prolonged at this time, but again, we can follow up with that data as soon as we're done with the press conference.
Governor, this is Alex with Channel 7.
Yes.
My first question is, are you disappointed to see Attorney General Leslie Rutledge post photos at an event with fellow GOP leaders not wearing masks, not social distancing? My second question is, as Dr. Romero is discouraging non-essential travel, have you considered reimposing any travel restrictions for out-of-state travelers coming to Arkansas?
Yeah. On the first part of your question, I think the Attorney General's answered that question in public fashion, and I think we'll leave it at that. In terms of the travel restrictions, I think that's the right message that Dr. Romero communicated in the CDC, that we should be mindful that travel adds to the risk of the spread. And so if we can minimize that and limit it to essential travel, then we ought to do that. And, you know, I know that, you know, if you've got someone across the globe that are, you know, across the states that needs to come home because of a break, you know, you've got to measure it as to whether that's essential and that's necessary for everybody's well-being. But I would encourage that if you do travel, that testing should be a part of those plans. And so if you travel out of necessity, look at the potential of getting a test. And I think that would be helpful to the traveler as well as everyone else.
Hey, Governor, this is Josh White with KAIT. I have 2 questions, if you'll allow. Number one, the group with the most positives is 0 to 17 at 9.7%, yet we are not doing any kind of restrictions or anything targeted to those ages. If they're the number 1 spreaders, why are we not targeting them? And then number 2, real quick, back in winter in January and February this year, absenteeisms in schools hovered around 10 to 15% because of flu. The state allowed the schools to close for 4-day weekends and even some for the whole week. Looking at absentee numbers now, We're well above that average, and yet we're not allowing schools to really move virtual or do split of virtual and classroom. Why does it seem easier to close for flu, yet harder for coronavirus?
I'm going to let Secretary answer the last part of that. In terms of the first part of the question on the age group of 0 to 17, they had a 9.7% increase in the number of cases week to week. They are under the same restrictions as everybody else. If they go to school, they wear a mask. If they go into a restaurant, they wear a mask. And so they have the same responsibility as everyone else. They probably in the school environment have more restrictions than someone in the average work environment actually. And that's what makes it a safer area. So we are paying close attention to that age group, and particularly that's the school age group, and we are focusing on that. Secretary Key?
I think the premise of the question is not correct. We are indeed working with districts every day that are shifting to virtual learning. They are shifting either at a grade level or a school level or in some cases a district level, and working with them quite well. I think the data that I mentioned earlier certainly speaks to the fact that schools are working hard to stay open. To compare a normal flu season with COVID is simply not a good comparison. Flu season is short-term, 2, 3, 4 days closure, and then those days are made up at the end of the school year. We are trying to keep the continuity of a school year going for as many students as we possibly can. And we will continue through the second half of the school year to work with districts to make sure that they can safely transition and meet the needs of their students' educational needs.
Let's take one last question, and some of these will be available afterwards for more. But is there one last question remotely, I hear?
Thank you, Governor. It's Neil Gladner in Hot Springs at KZNG. This is a question, I think, for Dr. Romero about vaccine distribution, and that is with 25,000 cases, doses of the vaccine coming. I presume they're not interchangeable. In other words, if you start with a Pfizer vaccine, your second dose has to be Pfizer. So do we have follow-up dates for other shipments? In other words, if we administer 25,000 doses to healthcare workers, you need to know when the next 25,000 of Pfizer are coming, or can a Moderna be the second dose?
The answer is yes, but Dr. Romero.
So thank you, Neil. The question is, we will be receiving, the answer to the question is, excuse me, we will be receiving at periodic intervals sufficient vaccine to keep going forward. And you're correct. Pfizer vaccine is not interchangeable, at least at this time, with Moderna vaccine. So a vaccinee who receives Pfizer must complete his vaccine with Pfizer. We have been told by the federal government that we will be receiving weekly aliquots or allotments of vaccine, which we will be using to immunize new individuals, and eventually 3 or 4 weeks we'll receive another allotment to go back to the first group and immunize them. So it's sequential and planned, and we will also receive the same with Moderna.
Thank you. And with that, let's conclude today, and we'll look forward to seeing you next time. Apologize, I have a commitment I've got to rush to, but Dr. Romero will be available if there's something to follow. Thank you.